Hi, my name is Jamie Antanashi and today is May 18th, 2022. I shadowed at my Practicum site during the 2021 to 2022 school year, and I am so excited to share my Practicum experience with all of you. I shadowed at Capital Pain Institute. It's super close by off of Shoal Creek, so it's super convenient, and they take on Practicum students almost every year, so the practice itself is really accustomed to teaching and having students around. I chose Capital Pain for a couple of reasons. The founder and president of Capital Pain is actually a close family friend of ours, so I had known about the practice for a while, and over the summer he had said that I could come shadow there. That being said, I still didn't have a formal place, and there was a lot of uncertainty in the fall due to COVID. So I printed out my resume and my cover letter, and I would drive around to different medical practices and ask about shadowing positions. When it came time to ask about shadowing at Capital Pain, I called the office manager that morning to let her know that I was coming into the practice. That day during the practicum period, I went and I interviewed with the office manager. She was so sweet and so supportive, and she was super helpful, and she gave me her contact information so that I could reach out to her directly. And I have communicated with her ever since going forward. By that time the next week, she had already found healthcare providers who were willing to take me on and who she could place me with. And I have been there ever since September 2nd. So with a brief moment where I was shadowing at Seton Hospital. But other than that, I spent my entire year at Capital Pain Institute, and I really communicated with the office manager there, and she was super helpful, and so was everybody there. So. There were two major things that I got to experience outside of shadowing the nurses and doctors at Capital Pain Institute. The first thing that I got to do was from early February to mid-March for about 6 weeks, all of the practicum students got to shadow at Ascension Seton Hospital. This was such a cool experience because we all rotated around different wings every day. So I got to shadow a bunch of different people in many different aspects of medical care, from cardiology to postpartum mother-baby to med-surg to neurology. It was very, very interesting. Seton is definitely a challenging experience because it involves a lot of personal initiative. You have to be assertive and ask questions and interact with adults in sometimes uncomfortable situations. So for example, maybe the charge nurse is busy and she's the person who's supposed to place you with the RN that you're supposed to be shadowing. Maybe the RN is in a bad mood and doesn't necessarily want to be interacting with a student. And so you really need to have that personal confidence and ability to know that your place is there, and to really be confident enough to ask the questions and to put yourself in uncomfortable situations even when it seems challenging in that kind of an environment. Despite that, I got so much out of it, and I absolutely love my time at the hospital. It's really, really helpful at developing those soft skills, which is something that is very highly emphasized in the practicum course. The other thing that I got to do besides shadowing in the clinic was, since we were close friends with the president of Capital Pain, I was able to reach out to their family and shadow him in a couple of different procedures. So I usually got to do this on days that we had off from school because he had a different work schedule than the hours that we were permitted to be at our practicum site. But I absolutely love this experience. I got to watch so many different procedures that help to treat chronic pain, from medial branch blocks to radiofrequency ablation procedures to spinal cord stimulator implants. And all of them are slightly different. Some of them were in the lumbar spine, some of them were in the cervical spine. But I learned so much from both surgery and clinic. And I also learned a lot about the difference in lifestyle and how people choose to balance the two, and the amount of time that providers will choose to spend in surgery versus clinic. And if you are interested in pursuing the health science practicum, I highly recommend that you shadow in both settings because there's so much that can be gained from both locations. I shadowed with very many providers while I was at Capital Pain, but I was mostly with two of the nurse practitioners there. The NPs were absolutely incredible. To this day, they are some of the most amazing mentors that I've ever had the privilege of being able to have. I plan to keep in touch with both of them throughout college and my professional career. I have their emails and their phone numbers. I absolutely adore them. In addition to these two nurses, I also shadowed a few other nurses, a couple of doctors, and I pretty regularly interacted with the office manager, Priscilla, that I mentioned earlier, and the medical assistants there, which were also so wonderful and so kind. Um, and then in addition to that, I also shadowed registered nurses, RNs who are at Seton. And then the difference between an RN and an NP is that an RN, you can get registered to be an RN pretty much straight out of college, and then an NP requires like a master's and additional schooling. So they're just a little bit more well versed in healthcare, and they're a little bit more specialized. So the NPs that I worked with were specialized in chronic pain, and the RNs kind of were able to be a little bit more versatile. And I loved the experience of shadowing both. They gained very different things from those two different levels of specialization, and I think that there's so much that can be gained from every title that there is out there. I also shadowed a PCT while I was at Seton, and they basically help out the nurses. They do a lot with patient cleanup, and I actually learned quite a lot from that woman as well. She was very fierce and very kind, and so she cared so passionately about all of her patients, and I just loved seeing the way that she cared for people. The best way that I was very close with almost all of the staff that I had the privilege of shadowing under. And the best way that I fostered these relationships with the staff was by asking questions and by being curious. In general, or at least in my experience, the providers are so much more excited when the student actually wants to be there and is passionate about learning about healthcare. I never hesitated to ask questions about terms, procedures, or pathophysiology that I was unsure about or didn't yet understand. And as I became more familiar with the practice, I started asking higher level questions about chronic pain and treatment plans, external factors, and social determinants of health, while also gaining more exposure to lifestyle factors for both doctors and patients, like insurance companies and what it's really like for women in medicine, because there are multiple female NPs and doctors who are at the practice. I think they really appreciated that I was and still am so eager to learn. And they even offered me a place to work and shadow over the summer, and I fully intend to take them up on that offer. The most challenging part of the practicum course this year was definitely learning to step out of my comfort zone when seeking opportunities with adults specifically. So I really had to put myself out there in the beginning of the year by going to different medical practice, as asking doctors and nurses if I could shadow with them. And then this was especially noticeable for me at Seton when I had to find a different RN to shadow every single day. Being uncertain and asking for help are not things that come naturally to me. I am very set in my ways and determined that I know how to do things right on the first try, and that's simply not always the case. And being a part of Practicum really forced me to step outside of that, because I needed to ask for help. I needed to ask if I didn't understand something that was going on. I needed to ask if I didn't know who I was supposed to be shadowing that day. And I needed to push through that in order to be successful and truly get as much as I possibly could out of this practicum experience. My favorite part of practicum this year was definitely forming relationships with the doctors and nurses at Capital Pain. While I started out curious but also very nervous, by the end of the year I felt super comfortable with all of the healthcare providers, and I had truly learned so much more than I ever thought I was going to when I first started practicum. Not only did I learn about medicine and lifestyle and healthcare, but I also learned a lot about people. I learned about the providers, the choices and the sacrifices they made about their careers, but also about the patients, about how mental health and chronic pain is so deeply intertwined, and treating one usually helps to treat the other. About social determinants of health and how people without access to healthy food, quality insurance, or a proper support system are more likely to have increased comorbidities and a harder time getting access to the healthcare that they need and deserve. About how some people constantly live their lives in pain while others are really able to heal. And it just completely depends on the individual, their mental and emotional state, and their body and what their body responds to. Not everyone truly is so different. It was the human connection with both the patients and the providers that I enjoyed most about this practicum experience. The most important thing that I've learned this year is to always be curious and to never underestimate myself. It was my curiosity and my eagerness to learn which took me so far in this program, and now I have an irreplaceable experience with some of the most knowledgeable and kind mentors I have ever met. Um, Throughout the year, the NP that I shadowed the most, her name was Selena, or is Selena. She told me that if I take one thing away from her, it's to never let anybody tell me that I can't go to medical school, or that I'm not good enough. She always encouraged my curiosity and was incredibly supportive. And pretty much every provider at the practice that I would talk to was very, very encouraging. And they were all super, super helpful. And not only, you know, bolstering my confidence in myself, but also helping me to identify what aspect of healthcare that I truly wanted to go into. And as soon as I decided that it was MD, doctor, every single one of them backed behind the fact that I can and will go to medical school and to never let anybody tell me otherwise, which was a very, very valuable lesson to learn from them. Her confidence and support, along with all of the other providers that I regularly interacted with, are tremendously encouraging and greatly helped to shape my passion and love for healing others. I went into practicum with medicine as just an interest in mind, and now I know that it is my path. My biggest piece of advice for future students who are participating in the medical practicum is to put yourself out there. You will learn so much about medicine if you just ask, but you'll learn even more about people and yourself if you really take advantage of all the knowledge and opportunities available to you. For example, I was so interested in my practicum and experience and at my site and what they were doing with chronic pain that I actively sought out opportunities outside of the clinic in terms of surgery and procedures, and I added a whole new dimension. I did that pretty early on in like October, and I added a whole new dimension of understanding to my knowledge of chronic pain and how things worked at the practice by doing so. So I really, really encourage that. Something that is helpful, something that the course description for practicum really emphasizes is soft skills. And while it may seem a little unnecessary or redundant or, annoying, I cannot tell you how important this is. The providers that you're with and the relationships that you build have the ability to make or break your practicum experience. I highly recommend Capital Pain Institute. They take students every year, but you can gain that connection almost anywhere. Everyone who is in practicum in the first place has obviously demonstrated their desire to learn and observe in medicine, so take advantage of that. Okay, and I think that is just about everything. Shadowing as a part of health science practicum this year has been by far been one of the most influential experiences that I have ever had. I've been fortunate enough to have the most incredible mentors, and I've learned so much about all aspects of healthcare, good and bad. Thank you so much for watching. Please feel free to reach out to me if you have any more specific questions on getting started in practicum next year.